Hello, good morning, good afternoon, or good evening, depending on where you are joining us from, and welcome to this press briefing of the Africa CDC, brought to you from the headquarters of the African Union in Addis Ababa in Ethiopia. My name is Wayne Musabayana, and I will do the moderation for today's briefing. We are joined, as usual, by Dr. John Nkengasong, who is the director of the Africa Centers for Disease Control and Prevention. And today, later on in our program, he will be joined by a stellar panel of experts who are going to be launching, to help him to launch, the Public Health Emergency Preparedness and Response Leadership Program for Africa. But that is in about 15 minutes' time. For now, I really want to introduce Dr. John Nkengasong, as well as just to give you the numbers that you can use to ask your questions when we come to the Q&A session. So the WhatsApp number that you can use for that is +251 9455 02310. That's +251 9455 02310. You are also free to utilize the Q&A section as well as to come through live on this platform. So we will start with the usual briefing by Dr. John of the COVID situation on our continent, and then we will move into that launch of that leadership program. So let me invite Dr. John Nkengasong, who is the director of the Africa CDC, to give us his usual Thursday morning brief on COVID-19 in Africa. Dr. John, good morning, and you have the floor.
Good morning, Wayne, and greetings to everyone from the Africa Centers for Disease Control and Prevention. And it's always good to be with you on this platform. As usual, we'll do our a three-parts presentation. Firstly, focusing on the epidemiological situation, evolution of the pandemic on our continent. Then discuss what we, Africa CDC and the African Union Commission are doing, and then end up with the vaccine and vaccination situation on our continent. So let's start with the epidemiological situation. As of today, May 6, as a continent, we have reported over 4.5 million cases of COVID-19. That represents a total of 3% of the cases globally. In terms of recovery, about 4 million of the 4.5 million have recovered across the continent, and that accounts for about 90% of the overall recoveries. In terms of death, as of today, the continent has reported 123,000 deaths, and that represents a case fatality rate of 2.7%. And if you put that in the context of the global deaths, our number of deaths represent 4% of the global number. The following 5 countries account for about 64% of all cases on the continent. South Africa representing 35% of the total cases, Morocco 11%, Tunisia 7%, Ethiopia 6%, Egypt 5%. The global case fatality rate is around 2.1%. If you now look at the variance situation, I mean, I will just give you the numbers since the number of countries have increased. The B117 variant has now been reported in 20 countries in Africa. The B135 variant has been reported now in 23 countries in Africa. 3 member states are now reporting the B1617 variant, originally reported in India. And they will include just 1 case in Uganda, 5 cases in Kenya, but investigation is ongoing. And Morocco is also investigating some of the cases there. So a lot of investigations still on the way, and hopefully by next week, we'll let you know the situation of the B1617 variant. that has been reported in India. If you now look at the 1 week trends from the last time we met on this platform to now, and that would be the epidemiological week 17, that spans between April 26 and May 2nd, we noticed the following trends. New cases, a total of 65,000 of the new cases have been reported since last week, representing a 10% decrease from the previous week. The highest proportion of new cases are from the following region: Northern Africa region with 38% of the cases, Southern Africa region 21%, East African region 21%, Central Africa region 12%, West Africa 7%. The following 5 countries are reporting the highest number of new cases: Tunisia, South Africa, Egypt, Cameroon, and Ethiopia. If you look at the deaths, a total of 2,181 new deaths were reported in Africa over this period, and this represents a 0.1% decrease compared to the previous week. That is number of deaths. If we now look at the 4 weeks, and the week that spans between the 5th of April and the 2nd of May, we observe the following trends. There have been an overall 5% average decrease in the new number of new cases across the continent. And the following are regional trends: 40% increase in Central Africa, 4% increase in Southern Africa, 0.2% increase in Northern Africa, 10% decrease in Western Africa, and 16% decrease in East Africa. In terms of new deaths, there have been an overall 4% average increase in new deaths reported in Africa each week. That is over the last four weeks. The following are the breakdown of the most populous countries: Egypt, 11% average increase; Kenya, 7% average increase; Ethiopia, 3% average increase; South Africa, 2% average decrease; DRC, 45% average decrease; and Nigeria, about 77% average decrease. Let me now transition to the testing. To date, over 44 million tests have been conducted on the continent. And over the period of last week, about 774,000 new tests have been conducted. And that represents a slight decrease of about 3% over that same period. The overall positivity rate is about 10.3%. And the test per case ratio is 9.7%. So if you recall, the WHO states it has put a threshold of at least 10 tests per case as the appropriate level of testing. So we are very close to that. Let me now conclude on vaccination. As of 4th of May this year, a total of 37.6 million vaccine doses have been acquired by member states, with approximately 20.2 million doses administered. These figures correspond to a coverage of about 1.1% of the continental level, with 0.39% of the population having received a full vaccination regimen, 0.39%. So we're slightly up by 0.02% from the previous week. To date, the African Union member states have used 53.8% of the vaccines supplies available. And in terms of the breakdown, they look as follows. Morocco has used about 9.4 million doses, representing 88% of its supply, with 11.7% of the population fully vaccinated. Nigeria has used 1.2 million doses, that is representing 29% of its supply use and 0.6% of the population vaccinated. Ethiopia has used up 1.1 million doses of vaccines, representing about 47% of its supply fully used, and that represents about 1.02% of its population. Egypt has used about 1 million doses, representing the uptake of 67% of its supply and 0.24% of the population fully vaccinated. And Kenya at 894,000 doses, representing an uptake of 88% of its supplies with 1.66% of the population vaccinated. As of April, as of the April 30th, the WHO listed the Moderna vaccine on its, which is an mRNA vaccine, on its list of vaccines that have been received emergency authorization use. On May 2nd, South Africa minister announced that the country will be receiving 325,000 doses of the Pfizer vaccines. The country expects a total of 1.3 million doses of vaccines to be delivered by the end of May, which will enable it to ramp up its vaccination campaign. Let me just conclude then by making my personal reflection on the news we just received yesterday that the United States government was going to provide a waiver, or was in favor of the waiver to the for intellectual property, which is really a remarkable expression of leadership and a very important development. If you all recall, just a few weeks ago, we organized a large vaccine meeting on the ability for the continent to produce vaccines and locally as part of our health security. And this development will continue to be build a momentum necessary to enable us to achieve that goal. It is a step in the right direction. And we believe that when the history of this pandemic is written, history will remember this, the move taken by the US government as doing the right thing at the right time to fight a terrible challenge, which is unprecedented in our own contemporary history. So we welcome that news, and we continue to look forward to working with the World Trade Organization to moving that process forward. I thank you, Wayne, for the opportunity.
Thank you very much, Dr. John. And colleagues, as I mentioned at the beginning, we are now moving into another section wherein our panelists who are joining Dr. John will be helping him to launch that very important public health emergency preparedness and response leadership program for our continent, Africa. So let me do the introductions for that section. Now, the whole program aims to nurture a unique type of leadership in safely managing the progressively increasing public health emergencies on our continent, Africa, through a collaborative approach. It will be targeting government and public health leaders in selected countries in sub-Saharan Africa. And it also aims to prepare our leaders to suitably devise a response strategy to public health challenges that result from natural disasters or disease outbreaks on the continent. So I spoke about a panel of experts. Let me just introduce them to you. So first, let me introduce Mr. Zweletu Bashman, and he is the Managing Director for South Africa and Sub-Saharan Africa for MSD. And MSD is a global company that invents medicines and vaccines for some of the world's most challenging diseases. They also focus on getting the medicines and vaccines to the people who need them. The next panelist that we have is Dr. Ambrose Talisouna. Dr. Talisouna is the program manager for emergency preparedness with the World Health Organization. And as we all know, the role of the WHO is to direct international health within the United Nations system and also to lead partners in global health responses. Next up, we are joined by Ms. Caroline Mbindio, and she is the CEO of AMREF Health Africa Innovation. So AMREF stands for the African Medical and Research Foundation. This is the largest Africa-based international NGO, and its focus is on increasing sustainable access, and it also runs programs in over 35 countries. It also engages in program development, fundraising, partnership, advocacy, monitoring, and evaluation. And then, of course, we have Dr. John Nkengasong, who is the director of the Africa CDC. And just to reiterate what the Africa CDC is there for, it is there to strengthen the capacity and capability institutions, as well as partnerships to detect and respond quickly and effectively to disease threats and outbreaks. That is based on data-driven interventions and programs. So that's our cast to take us through the launch of that very important program. So what I will do now is to invite them one by one to make their presentations. I'll start with the first three. So, and each one of them has exactly 5 minutes or less to make their presentation. So let me start by inviting Mr. Zweletu Bashman, the MD of South Africa and Sub-Saharan Africa for MSD. Mr. Zweletu, you have the floor.
Thank you very much. I really do appreciate the opportunity to participate in this session. It really is a program that we are excited to launch, and I think it will have huge value for the continent at large. One of the biggest lessons that we've learned from the COVID pandemic is that collaboration and co-creation are necessary for humanity to speedily work itself out of challenging situations. MSD has been involved in these efforts for many a year. We've learned that it's not just vaccines and medicines that save lives. It's actually the physical act of vaccinating and treating people that does. That is the reason why we don't just focus on developing innovative medicines and vaccines. We also focus on capacity building around preparedness in countries at risk of public health emergencies. Our collaborative efforts in the Ebola outbreak response showed us that there's a great need for programs such as this one. Our participation exemplifies our commitment to innovation, partnership, public health, and strengthening African healthcare systems. We firmly believe that a well-trained and empowered response force can better anticipate risks and mitigate the impact caused by pandemics, thus contributing to the achievement of the Sustainable Development Goals. And so it's for the above reasons that MSD, in partnership with Africa CDC, the WHO, as well as AMREF Health Africa, collaborated to co-create this leadership training program for government and public health leaders across select countries across Africa. We envision that this platform will allow diverse stakeholders to share best practice, challenges, and perspective that will ultimately lead to resilient healthcare systems that are better prepared for rapid and effective containment of disease outbreaks across Africa. So we really do want to thank you all for allowing us to participate in this journey. And we certainly believe that this will be something that will be a quantum leap in the efforts across Africa to deal with outbreaks. Thank you very much.
Thank you very much, Mr. Zweletu Bashman. And I noticed there that you're talking about coordination and collaboration as being really key in dealing with public health issues. They also form part of the strategy of the Africa CDC's response strategy. So now it is time for me to call in Dr. Ambrose Talisouna from the World Health Organization. Dr. Ambrose, you have the floor.
Thank you very much. Good morning, good afternoon, wherever you may be, colleagues. And as WHO, we are really very glad to join the Africa CDC, MSD, and AMREF at this launch of the Public Health Emergency Preparedness Leadership Program. As a context, let me just start by giving you the statistics. Annually, the continent experiences over 100 infectious disease outbreaks. But the fragile health systems charged with detecting and responding to those public health emergencies are really not to standard. The COVID-19 pandemic has unraveled very, very major health system flows. It's affecting all 4 interconnected health system performance capacities. It has affected the access capacity, the quality capacity. It has affected the demand capacity, but more importantly,